Hey there! Today we're diving into 7 surprising signs you might have low iron, even if you don't actually have anemia. Let's get started. So why is iron so important anyway? Well, iron is kind of like your body's oxygen delivery service. It helps make hemoglobin, which is the protein in your red blood cells that carries oxygen from your lungs to, honestly, every single cell in your body. Without enough iron, your body just can't make enough healthy red blood cells, and this can lead to anemia. But here's the twist. You can still have iron deficiency without full-blown anemia, and the symptoms can really sneak up on you. So, let's break it all down, starting with the causes of low iron, and then moving into the 7 signs your body might be running on empty. What causes low iron? Well, let's take a closer look. So, blood loss. Whether it's from heavy menstrual cycles, gastrointestinal bleeding, injury, or even frequent blood donation, iron loss can really add up quickly. If you're skipping red meat or leafy greens, you're probably not getting enough heme iron, which is, the easily absorbed kind found in animal products. Here's a quick tip. If you're relying on plant-based iron or non-heme sources, pair them with vitamin C to boost absorption. Honestly, a glass of orange juice does wonders. So, even if you're eating well, certain conditions like celiac disease or if you've had gastric bypass surgery can really interfere with how your body absorbs iron. Iron demands just skyrocket during and after pregnancy. That's actually why expecting or new moms are at a much higher risk. Did you know women between the ages of 19 and 50 need about 18 milligrams of iron daily? But after menopause, that number drops to 8 milligrams. Unless, of course, they're still menstruating. So let's talk about the 7 warning signs of low iron that honestly you really shouldn't ignore. First up, hair loss. Losing between 50 to 100 hairs a day is totally normal. But if you're noticing your hair thinning out or just not growing like it used to, well, it could be linked to low iron. This actually happens because of something called telogen effluvium, where more hair follicles kind of go into a rest mode and just stop growing. Next, let's chat about strange cravings, also known as pica. Have you ever found yourself craving dirt, ice cubes, chalk, soap, or, oddly enough, even burnt matches? That's pica, and it's really strongly linked to low iron. It's basically your body's bizarre way of screaming for nutrients. So let's talk about pale skin, especially under your eyes. Iron-poor blood cells are actually paler, so your skin loses some of its color too. For a quick check, just pull down your lower eyelid. If it's not bright red, well, that may be a sign of iron deficiency. Next, let's look at cold hands and feet. With low oxygen delivery, your body tries to save what it can for your vital organs, leaving your extremities feeling freezing. And low iron may also affect your thyroid, which is what regulates your body temperature. Now, brittle or spoon-shaped nails are another thing to watch for. Early on, your nails might chip or break easily. Later, they can actually curve inward like a spoon. This is called koilonychia. It's a classic red flag for long-standing iron deficiency. So, shortness of breath? Yeah, even when you're just resting, or especially when lying down, you might notice that you're feeling out of breath. That's because, without enough red blood cells, your body's ability to deliver oxygen really falters. And now, heart palpitations. Your heart starts to work overtime to make up for low oxygen in your system. This can lead to rapid or even irregular heartbeats. Seriously, don't brush this off. It's important to pay attention. So how can you know for sure if you're low on iron? Well, the answer is simple. Get tested. Just ask your doctor for a few key tests, like a complete blood count, serum ferritin, iron and total iron binding capacity, and transferrin saturation. These tests together, they really give you a full picture of your iron status, before you even think about starting supplements. When it comes to choosing the right iron supplement, there are basically 2 most common types you'll hear about. There's ferrous sulfate, which is usually 325 milligrams and gives you 65 milligrams of elemental iron. And then there's ferrous gluconate, which is a bit gentler on the stomach, but it does have less iron per dose. Okay, here are 8 tips for taking iron the right way. First, iron is best absorbed on an empty stomach, but honestly, if it upsets your stomach, it's totally fine to take it with a light snack. Avoid dairy for about 2 hours before or after taking iron. Calcium can block absorption. The same goes for antacids, tea, coffee, and high-fiber foods. It's a great idea to pair your iron with vitamin C. A glass of orange juice is just perfect. And don't worry if your stool turns dark. That's actually totally normal. You might also consider taking iron every other day, since some studies show your body absorbs it better that way. Try to avoid slow-release or enteric-coated versions because they may not absorb well. And finally, track your labs every 6 months so you can really monitor your progress. So just to wrap things up, iron deficiency is incredibly common. But the good news is, it's also treatable. Knowing the signs can help you take action before it turns into anemia. If you relate to any of the symptoms we talked about, don't try to self-diagnose. Get tested and speak to your doctor. Your energy, your hair, your heart, and even your nails will thank you.